Speak now to Professor Adrian Puren. He's the head of the Centre of HIV and STIs at the National Institute of Communicable Diseases. Good evening to you, Prof. Gauteng is recording, as of the middle of March, an uptick in numbers. Is that mirrored across the country?
In some ways, yes, it is. But I think we just need to be cautious about that. I think the only obvious one where you can really see that uptick is in fact, the Northern Cape. But overall, South Africa has really come out of the, if you like, the resurgence or the second wave. But however, we just need to be cautious as to when you go down to district levels, what's actually happening there. So again, if you look at Northern Cape, one may have to really focus on perhaps a particular district or within that district, which will allow us to really tell whether or not there are clusters of cases, for example, maybe at schools or universities where these outbreaks are really contributing to the numbers that we're currently seeing. But overall, I think we're out of the resurgence, but it's really the planning for as you said, the likely third wave.
So the second wave looks behind us, but have we actually returned to our lowest lows after the first wave?
I don't think we have, Sally, and as you said, there is some evidence of an uptick in the numbers, but overall I think it is in control. But again, when you look at South Africa overall, and that includes Gauteng, the main picture that you would get actually is that there is control. However, when you go down to a district level, so for example in Gauteng, if you go to the city of Tshwane or Sedibeng or the West, you do see that you actually need to be on more of an alert than, for example, the city of Johannesburg or a city of Tshwane. So those are the differences, and that's the sort of way in which I would think that at provincial level and therefore at district level, we need to keep a focus on what's contributing this and how can we manage and control that to prevent, as far as possible, the third resurgence, yes.
Do you think that uptick in certain areas is because of the relaxation to level 1, that it's inevitable? It's about how well controlled it is and making sure that we don't have a sharp rise in infections, so that keep it under control, essentially?
Essentially, yes. So, as you know, we were at level 1 when we certainly saw the resurgence, and in fact it was only in part the implementation of the level 3 that allowed us to regain some of those levels of control. But it comes back to our communication to everyone in terms of understanding how we're going to manage this, or the difficulties of managing the resurgence. I think that's going to be really critical, is how do you manage your risk? Do I understand what is causing this transmission? And if that is the case, how can I manage it? And I think, obviously, we're finding it very difficult to control the transmissions. So, circumstances of high mobility, congregations, those are the elements where we're obviously finding it very difficult.
Health experts tell us it's not if there's going to be a third wave, it is when. It's definitely going to happen. Why is it a fait accompli? Why is it definite?
In essence, because I think we're finding it difficult to control transmission. I think we, in particular settings where it may be very difficult to introduce, for example, or apply the non-pharmaceutical interventions and adherence to those, and, for example, the physical distancing, the hand hygiene, the wearing of masks. And again, I come back to the wearing of masks seem to be a really critical factor. And again, the congregation, those areas where people are able to gather, which allows for transmission. I think it's also about our understanding of what that risk is. How is this virus transmitted, and therefore how do we control it? And I think if we don't understand that, I think then transmission is just going to continue as we see, no matter which part of the society we're in.
Is it possible to predict when the third wave might hit us? Because obviously we've got the Easter weekend coming up. That's from the 2nd of April. Then winter coming in, obviously later May, June. When it gets cold, we tend to stay inside, which means the virus can spread because there's less ventilation. How concerned are you that we might be hitting that third wave early? Because early indications were it might be May, June. Could it be earlier?
It's very difficult to predict, Sally. As we've been through a really large resurgence, and I know that contributes to some degree of immunity. So it's those types of factors. For example, it comes back to the adherence, our ability to control the non-pharmaceutical interventions, but it's things like immunity, for example. If another lineage or variant comes along that's more highly transmissible, or if this one remains transmissible, we know that that will actually, if you like, spur on But you're right, if winter comes along and more people come into contact with each other, then yes, certainly that resurgence can come along. But I think it's been really difficult, I think, for the modellers to come up with some sort of estimate of when that will actually happen and the nature of the actual research.
And thank you very much. And I think clearly the message is, in a world when there's so little that we can control, we need to just focus on the things that we can control, which of course is social distancing, wearing our mask, sanitizing our hands, and just being careful not to be in large crowds, not to be part of super spreader events, particularly over the Easter period. Professor Adrian Puren, head of the Centre of HIV and STIs at the National Institute of Communicable Diseases, thank you very much for joining us this